Heidi, you've been looking into this because it just seemed quite unusual. Just before we get to that, talk to us about the registration process. I think the last time we spoke, when the registration for the 60-pluses opened, it was something really low, like 10% had registered. How's it going now?
Yes, certainly, Sally. It was just under 10% of the senior citizens, those that are 60 and above, that had registered on the electronic vaccination data system. But the MEC for Health, specifically here in Gauteng, today received a couple of calls at a call centre that's specifically dedicated to helping the elderly and senior citizens with regards to vaccination registration. We know phase 2 is supposed to begin on Monday. But what's interesting here is that Gauteng specifically is expected to inoculate over 1 million those 60 and above, specifically 1.3 million 60 and above. But we do understand that only 247,000 odd have registered on the electronic vaccine data system. According to the MEC, though, she does not believe that these numbers are worrying. She says that people just need some guidance. They need assistance, especially those that aren't tech savvy or do not have smartphones to register on the system. And this is why they've launched this call centre to assist those. But the numbers are worrying, Sally. If I look at it, if you are expecting to inoculate 1.3 million only in Gauteng and not even 500,000 have registered, what does this tell you? What are some of the problems? The MEC says some of the problems speak to the fact that people don't have access, they don't know how to register, but also that there is some kind of reluctance to get the vaccine. But let's listen further to the MEC today.
It takes a little bit of a time because you need to interact with the client and try to explain the benefits of having the vaccine or to be vaccinated. And then some of them will tell you that I've already registered. And then you can't just leave them when they say they've already registered. You just need to put them in the system, and then the system will be able to tell if the person has already been registered or not. But from the experience that I had with the 4 that I interacted with, it gives you, you can feel the excitement from the one that, the 3 that I spoke to. And then in most cases, elderly people, they don't carry their phones. You find that the grandchildren are the ones that are having their phones. So it also takes time because you have to first convince the grandchild so that the grandchild can speak to the elderly.
All right, so it's quite interesting if we look at Gauteng. As you say, Heidi, there's approximately 1.3 million people over 60 in this province alone. But it seems from what you're telling us that less than a fifth have actually registered. Of those that have registered, do they know when they must report for their vaccinations, or can they simply turn up at their closest vaccination centre on Monday?
I think this is a really concerning picture, Sally, because those that have registered do not know where they're going to go on Monday. Phase 2 begins on Monday, where those that are 60 and above need to go to vaccination centres and get their jabs, but they do not know where to go. No SMS has been sent. And what's interesting here is that when this was posed to the MEC today, when ENCA asked the MEC, what do people do as of Monday? Where are the vaccination centres? What time? When are they supposed to get there? How much time is going to be allocated for each individual to get the vaccine? We know currently it takes almost 4 hours for an individual to get the vaccine. How is this going to work when you're dealing with senior citizens? The MEC is saying that, according to her understanding, the SMS is already sent. And I said, no SMS has been sent. The only SMS that has been sent is the fact that your registration is successful or not. So, of course, the Department of Health needs to give more clarity on what those that are 60 and above need to do come Monday. But the MEC is saying that nobody's compelled to get the vaccine, and the numbers that we are seeing speak to the fact that they are, the numbers that have already registered, they believe it's going to increase in the next couple of days. And when people start actually getting the vaccine as of Monday, hopefully, they believe more people will register and more people will feel comfortable in registering. Let's listen to the MEC once again.
Remember, you cannot force the person to get the vaccine. We need to give them time. If a person says, I need to think through, give them that time so that they can think through and then come back. And so far, we have already, I think as yesterday, we have registered 247,149. But as you can see, the numbers are increasing. And then I think by the end of the day today, would have the number would have exceeded, since you can see that the uptake is a little bit better.
All right, so hopefully people will be encouraged when they see their friends getting the vaccination, and that will lead to more people registering. So, Heidi, the national picture, do we have that as yet? Because we know that there are 5.5 million or so 60-plus people who could actually be registering for this vaccine. We've also been told that from between the 17th of May, when phase 2 starts, and the end of June, the goal is to vaccinate all those 5.5 million. I've done a bit of a calculation on those 45 days. That means over 120,000 vaccinations a day, starting Monday. Yesterday was our highest vaccination level ever. That was less than 20,000. It's an enormous hill to climb. So, A, are there national pictures? And B, what about this issue regarding some elderly people already getting their jabs? Has it been cleared up?
I love your question. Unfortunately, I don't have answers. We have been trying, Sally, to try and get a national picture as to how many people have registered. We know when the electronic vaccination data system was launched, we got a figure of less than 10% of the 5 million that had registered, and we're not sure what the national picture is looking like 5 days ahead of phase 2 kicking off. We know what Gauteng looks like. We've been told by the MEC it's just under 247,000. Those 60 and above that have registered, but we're not sure what the national picture looks like. We do understand, though, that the Department of Health will most likely release some of those figures and possibly further directive as to what those 60 and above need to do come Monday.
All right, let's just take a little listen now. You have raised this issue with the MEC about elderly people who seem to already be getting inoculated. And you were told, no, they're actually getting the flu jab. Tell us more.
Yes, so this was a crucial question that we asked the MEC today, because yesterday ENCA was on the ground at a vaccination centre here in Johannesburg, and we picked up the fact that there were elderly in the queue, those that were on wheelchairs, and one could evidently see that they were elderly, and we were actually told by people on the ground, Sally, that indeed they are being vaccinated because they need to get done with the Sisonke trial. The Sisonke trial, of course, focused on healthcare workers, and it's the 500,000 Johnson & Johnson vaccines that we saw. It's a study that's currently underway. They expect that to conclude on Friday. But we were told that because they had seen a low turnout from healthcare workers and support staff, which the Sisonke trial is focusing on, they opened that up. A large number of elderly people got to the vaccination centre, and they felt that they could not turn them away. We also asked a couple of people who did tell us that they were there. They had previously been in some kind of health department or health sector, and this is why they felt the need to get that. The MEC, however, Sally, told us that it's not the COVID vaccine, it's rather the flu vaccine that they are getting there at the vaccination centres, which is not the case, because a vaccination centre is for COVID-19 vaccines. That's why they have been established. We know that also the co-lead investigator, Professor Linda Gale-Becker, told Shahan earlier on that it's only for healthcare workers. So we're not entirely sure what's going on, but our sources on the ground and evidently clearly shows to us that it's elderly people. But let's listen to the MEC's explanation.
As for the elderly, my understanding is that no elderly has received any vaccination. Maybe they might be talking about the flu vaccine, because we were rolling out the flu vaccine, I think, starting from around the second week of April or so. I don't think it's a vaccine.
All right, thank you so much for bringing us the very latest on what's happening with the COVID vaccination centres. Heidi Giokos there. Now,